So I'm a physician assistant, a part of the orthopedic trauma team, and I'm a part of that wonderful team that works with the patients, communicates with the patients during the initial injury, so I get to meet them at the forefront of a devastating injury. I get to work with them and speak to the surgeons about how to best plan and get them to the OR to help fix them. And it's wonderful because I get to see them in clinic and follow up and be able to see their progression over time. What's really unique about orthopedic trauma is the variety of what you get to see. It's a pretty unique subspecialty of orthopedics, and you get to see everything it's going to be different from a day-to-day basis. And so that really excites me as a lifelong learner to come in every day and not know what to expect, and then to be able to kind of use my brain and speak to the surgeons and kind of figure out what we need to do in order to have the best outcome for the patient. One of the ways that I try to inspire health in a patient is letting them know what the risks and benefits are, and it's important to know that you're partnering with them. You're not making the decisions for them. In the area of orthopedic trauma, I often come across patients that come in as traumas, and that initial interaction is often not the greatest. They're not able to communicate with me, and to be able to see them with a broken bone and then go to the OR and then later on the floor where they're able to communicate with me and they're awake and talking is pretty remarkable in terms of what we're able to do for them. So that is really meaningful for me as a provider, and I think fulfilling for the patient as well. So it's important to speak to the patients and educate them about what to expect and kind of give them the reality of what's going to happen. They've been through some traumatic things, and so it's important to be supportive and kind of walk them through and be there if they need anything.